Good morning, and thank you for having me. Well, we have done preparations in according to the modeling that we've received. We are due to bring a number of additional beds online by the end of next week, which is the first week of August, expecting the peak in the province to hit us at the end of August towards September. What we have done, though, is to be able to do a number of things. One, firstly, is to be able to expand the capacity in our current hospitals. So we're working in 9 facilities. Over and above that is the field hospitals that you are speaking of, 4 which we are busy rolling out with SANDF. So those hospitals are not yet in use, yes. Of the field hospitals, we are only using Nasrec. I think what the Department of Health has actually done quite well is to manage the admissions. So there's not been a situation, fortunately, where we've not been able to admit anybody. The hospitals are being used in a cluster manner, and they manage the admissions. Nasrec is being used, but it's not even full to capacity. So I think what we've done is to be able to make sure that by the time the peak hits, we would have the necessary bed capacity. Just from what we know and what we've experienced and what our health practitioners are telling us is that many people are able to isolate and quarantine at home, and really the admissions are for those who really need, and it's from the modeling it's showing that really 2% or even less may need actual.
So Tasneem, from what you're saying to us, as the MEC for Infrastructure Development, you're quite happy with how Gauteng has responded to the COVID-19 peak, with 1 out of the 4 planned sites that have been earmarked for field hospitals being in operation?
I think I am anxious, yes. You're never quite 100% happy given the situation. None of us know exactly what can happen. So we're always anxious. 1 out of the planned field hospitals is operational. The rest are being constructed or being readied. And like I said, Nasrec is not even full to capacity. So it means that we do have space. We did add additional beds at Nasrec in phase 2 of the process. But I remain always 100% anxious all the time. You never know what.
So you're saying Nasrec isn't at capacity, but isn't that because not all of the beds are oxygenated and not all of the beds are staffed, not because there's this excess capacity that we have in our field hospitals?
Well, I think the issues of staff and medical equipment remains the responsibility of the Department of Health. They have put a plan in place to be able to make sure that staff rotate between facilities. I do know that we also have a HR plan of recruiting staff. But the bed capacity is there. What we obviously require is then the staff as well as the medical equipment, which is the responsibility of health. But they've put an adequate plan in place to be able to rotate, use facilities cross-sectionally, if need be. So I think we've done well. They have done what they can under the circumstances.
Would you also say that the responsibility falls on the Department of Health when we look at an issue like Helen Joseph Hospital,